welcome everybody being here today. The call includes both closed captioning and ASL support. To access the closed captioning, click the More button at the bottom of your screen, then click the Captions option. From there, you can adjust the caption size and select to view it as a full transcript or on the bottom or side of your screen. Our ASL interpreters on today's call are Julia and Carly. They will be spotlighted on the screen for full access for the duration of the call. If the webinar is Zoom bombed, we will close the session and then reopen it. Participants will need to rejoin the event using the call link they received in their registration email. They will be admitted once registration is confirmed. So on that note, Darcy, take it away.
Thank you, Rena, and thank you all for bearing with us. I'm Darcy Robb. For those who don't know me, I'm the Executive Director of the Georgia Council on Developmental Disabilities. On behalf of the Georgia Advocacy Office, the Georgia Council on Developmental Disabilities, the Center for Leadership and Disability, the Institute for Human Development and Disability, and the Statewide Independent Living Council of Georgia. Thank you all so much for joining us for this federal issues call today. There's a lot going on, and we want to get you the most updated information we can so that we can all stay engaged and take the actions we need to take. I am a white woman with salt and pepper hair wearing a bright pink top. I'm going to just briefly introduce the rest of the folks that you are going to see speaking today. In addition to myself, Darcy with GCDD, you're going to hear from our GCDD public policy team, which is Charlotte Densmore and Charlie Miller. From the Georgia Advocacy Office, you will hear from Rena Harris, who spoke at the beginning, and also from Dana Lloyd. From IHDD, you will hear from Dr. Zoe Stoneman. From CLD, you will hear from Mark Crenshaw. And from Silk, you will hear from Shelley Simmons. That's a lot of folks and a lot of agencies, but what we all have in common is that our purpose is to identify and solve issues that impact people with disabilities in their communities. And that's all in service of the vision that ultimately, and the truth that everyone with disabilities needs to live and thrive in their community. That's really key. As in the year before our agencies began back in the 1950s and 1960s, it was not a given that people with disabilities lived in the community. A lot of folks went to institutions. So all of our organizations are doing this work because we are part of this really great and exciting thing of making sure everybody can have a good life in the community. So that and the issues we're facing today are why we're coming together to do this call. Thank you so much for taking your time to join us, and I'm going to pass it back to Rena to get into our agenda. And Rena, you are there.
I am Rena Harris. Thank you, Darcy. And I, with the Georgia Advocacy Office, I am a white woman with salt and pepper hair wearing a white shirt and a black jacket. And I am going to try to share my screen as we are going. Can somebody confirm that you see the PowerPoint?
Yes, we do.
All right, awesome. It should say federal updates on Medicaid and the Health and Human Services budget and how they will affect Georgians with disabilities. So we are having this call so we can make sure that you as Georgians are fully educated, fully informed about literally like the up to the minute stuff that is going on, and have what you need to be able to educate legislators alongside us. We're going to go over what each of our organizations does in Georgia. We're going to talk about the threats to Medicaid and to the DD network and what we can do about it. And then we're going to have question and answer at the end. If you want to type your question in the chat, that is fine. We are going to hold all questions until we're done with the presentation, and then we will start reading the questions in the chat. out loud and let the subject matter experts answer them live. That way you don't have to pay attention to people talking and the chat at the same time. So on that note, we will go into what each of our organizations does in Georgia. You may have also received an email with information about all of our organizations since
Apple tastes weird.
They're not.
I mean, I know they're Apple.
They're the small bag that if I'm individually.
since we only have a short time today, may I ask folks to please mute themselves? Okay. All right, Darcy, council friends.
Hey, everyone. So back to me again. So at GCDD, we are sometimes known as the council. Our focus is really on these three first things you see at the top of the slide, which is our federally mandated purpose is to do advocacy, capacity building, and system change. So we really try to focus on those big buckets as ways of improving Georgia's communities and the support services and systems in place for people with developmental disabilities and their families to live better lives. The way we do that, we have projects, all kinds of projects that go on in places all over the state. We do a lot of public policy work, and we also put out a lot of information and resources. We are also governed by a council of members, and that's really important to know about us. You can see on the right, you've got a picture of several of our members being sworn in by Governor Kemp last summer. But over 60% of our members are people who have a developmental disability or they're family members of someone with a developmental disability. So that's a really big key in terms of that's where we get our governing decisions is from folks who are in the disability community and state agency representatives. That's our council. Going on to the next slide, please. So these are just a few examples of some of the work that we do. We are well known for our inclusive post-secondary programs, which we support at 10 colleges and universities across the state. These are inclusive programs where students with intellectual disabilities go to class, do internships, social activities alongside their typically or alongside peers with and without disabilities. Outcomes are very strong for folks who go through these programs. You can see our latest data shows 58% of them are employed 3 months after graduation, a much smaller number of peers who don't go. We also fund the Advancing Employment Project at the University of Georgia. I think Zoe is going to talk to you a bit about that, but that helps providers transition to employment models that help people work for competitive wages. Our policy work last year, we were very proud to be the technical advisor on Georgia as model employer or GAIN legislation. That legislation is making it so that all state agencies are getting training right now, which is actually a project of GCDD's as well, on how to hire, retain employees with disabilities. And our technology education initiative is just one final piece. To date, we've trained over 500 people on tech skills to boost their independence, their safety, and their quality of life. We do all this for just about $3 million in state and federal funds. And you can see our fun fact at the end. It's a tiny sliver of the federal and of the state budget. Before passing it over to GAO, I just want to note that we do have a comment in the chat that if there are folks you're in touch with who are trying to join, we're told that people can join via phone. So if anyone asks you if you could pass on that message. And over to GAO.
Thank you, Darcy. And again, we apologize for the technical difficulties. Please send that over to folks you know who are unable to get on the call right now. But I am Rena Harris, again, with the Georgia Advocacy Office, and I'm going to talk for a moment about who the Georgia Advocacy Office is. We protect and advance the civil and human rights of people with disabilities. That is our love. That is what we do. Our mission is to organize resources and follow our values and legal mandates in ways that substantially increase the number of people who are voluntarily standing beside and for people in Georgia who have disabilities and mental illness. At the Georgia Advocacy Office, we have 4 main priorities in all of the work that we do falls under one of these priorities. Our highest priority is preventing abuse, neglect, exploitation, and preventable deaths. We also support people to have equal access to services and supports. We assist people to fully participate in community life, and we support children to live with permanent, loving families. Within those 4 priorities, we advocate in many different ways. Just as an example, we investigate abuse, neglect, exploitation, and suspicious deaths. We monitor and investigate places where people with disabilities receive services. This includes group homes, day programs, state hospitals, crisis homes, and other locations as well. We provide individual advocacy, and we also support self-advocacy. For example, you are likely aware of our project called Supported Decision Making. That is a wonderful example about how we support self-advocacy. We also engage in a lot of systemic projects that fall within our priorities. Some of you may have heard of the project that we're working on to flag substantiated abusers from being able to continue to work with the disabled population and others. We also provide legal services. We work with reduction in denial of Medicaid, and we also work on guardianship removal. One of the projects that I don't want to neglect to mention that we work on is that we're currently representing a class of children to require the state to provide necessary services in their homes rather than in institutions. So those are some examples of the things that we do at the Georgia Advocacy Office to advocate. We have 10 programs that we use to accomplish all of these priorities. And this lists all of our 10 programs, and I am happy to talk more about the Georgia Advocacy Office and what we do if you would like to reach out to me. Zoe, sending it to you.
Thank you. I am Zoe Stoneman. I direct a program on the University of Georgia campus called the Institute on Human Development and Disability. And we are one of 2 centers in the state that are university centers for excellence in developmental disabilities. And you'll hear from the second one in just a moment at Georgia State. We are mandated as what we call USEDS. It's a shortage for Centers for Excellence, to do 4 things. We educate students on our campuses to support people with disabilities across the lifespan. We do outreach, we do technical assistance. We conduct research on topics that benefit people with disabilities and their families, and we disseminate information in a variety of formats. And as our faculty and staff got together, we came up with a series of impacts our programs have had. And our program has existed now for 50 years, over 50 years. And we've been doing a lot of what I think are amazing things like others in the network. We have people all over the state working to support farm families. Agriculture is one of Georgia's biggest employers, and many farmers have to give up their farms when they have injuries, strokes, but assistive technology can turn that around. And our agribility program for 20 years has served close to 250 farmers, allowing them to keep their farms through wonderful, innovative assistive technology. As Darcy said, we also have the Advancing Employment Technical Assistance Center for the state. It's been estimated at $1.5 billion of savings happen nationally when people with disabilities work and pay taxes instead of sitting home or sitting in sheltered workshops and day programs. We are very excited about the work of that center. We are very excited also about work that our faculty are doing to help with the direct support workforce crisis. The very first test for direct support professionals has just been developed and validated here at UGA. 426 direct support staff professionals have taken that test, passed, and now moved on to career enhancement to help them stay in the field. We are working hard to keep families together. by providing a lot of materials and information to people about how you keep kids from having to leave their families and go into nursing homes and other settings. And I'll end by saying one of my big heart warming things is we just graduated another class of UGA students, and nothing gives me more pleasure than the young people we are teaching and the wonderful things they're about ready to do for people with disabilities across the country. And at this point, I will turn it over to Mark for our other USAID.
Good afternoon, y'all. Thanks for being here. Thanks for joining the call today and learning about this work and the education that you can do with your policymakers. As Zoe said, I'm Mark Crenshaw. I'm one of the assistant directors at the Center for Leadership and Disability at Georgia State University. We too are a university center for excellence in developmental disabilities. We don't have quite as long a history as our colleagues at University of Georgia, but we've been around for about 15 years in the state of Georgia. Our mission is to translate research into community practice. So it's not just research for the sake of research, but it's research for the sake of helping people with disabilities in Georgia and their families have better lives. Some of the examples of our work that I wanted to highlight have to do with in the last year through our training programs. We've trained over 1,600 professionals who serve people with disabilities so that they're better able to support people with disabilities to live in their communities and have the healthcare services they need. We have done a bunch of research and evaluation related to collecting data and analyzing current practices around screening children with autism, providing support to parents of youth with disabilities, and through one of our statewide disability health programs, meeting unmet healthcare needs, connecting people with disabilities to providers to help meet unmet healthcare needs. And then our information dissemination has to do with sharing information about policies and best practices to help ensure that Georgians with disabilities stay in their communities and that they're informed and up to date on current evidence and practice. So thanks for listening to me about that. And I think next we'll hear from Shelley Simmons from the Silk.
I wonder can anybody tell me if Shelley is on the call or if she was bounced back? I will go ahead and present for Shelley while we are working on getting her in. Why is the statewide Independent Living Council of Georgia important? They are staffed and governed by people with disabilities who understand the needs of people with disabilities and the obstacles that they face. The role of the statewide Independent Living Council is to identify societal barriers to independent living and to collaborate with the Centers for Independent Living, Rehabilitation Services, and other related entities to remove the barriers and to increase the support and services needed to create independent living opportunities. I don't know offhand how many Centers for Independent Living there are. I know there are many, so if somebody who knows could share that in the chat, that would be wonderful. The statewide Independent Living Council of Georgia supports the Centers for Independent Living in providing services, doing individual advocacy and systems advocacy, peer counseling and peer support, information and referral, independent living skills training, and transition services. The statewide Independent Living Council of Georgia is a policy resource for state officials providing expertise on the issues facing people with disabilities and independent living. At this point, we would like to talk to you about what is happening with Medicaid. And I invite Charlotte Densmore and Charlie Miller to present.
Thank you, Rena. Good afternoon, folks. My name is Charlie Miller. I am the Legislative Advocacy Director with the Georgia Council on Developmental Disabilities. So we really wanted to chat with you all today because there is a lot happening federally on the Medicaid issues and that not only affect Georgia but all throughout the United States. But before we go into a deep dive, we want to kind of give a high level view of what is Medicaid. Medicaid is a joint federal and state program that provides health care, health coverage to low income individuals, including people those with disabilities. Georgia's Medicaid is on a waiver system, and uh, uh, a few of those waivers we'll go over today, like ICWP, Independent Care Waiver for people with physical disabilities or brain injuries, Katie Beckett Deeming Waiver for children with significant disabilities, now in comp waivers, the new option and comprehensive waiver for people with developmental disabilities, and also community care service programs, CCSP, and service options using resources in community environments, source for elderly people or people with disabilities needing nursing facility level of care who are not served elsewhere. It is important to understand that these waivers enable individuals with disabilities to receive care in the community rather than institutions that we all fight. I Can you click the next slide, please? And I'll pass it over to my colleague, Charlotte Dinsmore, to talk about where we are in the process.
Thanks so much, Charlie. I know we're all here because it's happening right now. We are in the middle of the Medicaid budget process. So what this means is Congress decides how much money the federal government spends on programs like Medicaid. This is up to the House Committee on Energy and Commerce. Earlier this year, that House Committee was told to find $880 billion with a B, dollars in budget cuts over the next 10 years. Late on Sunday night, the committee released their latest and most detailed plan for how they want to make those cuts, which we're going to talk about a little bit more in detail on the next slide. But before this bill can become law, the committee has to vote on it. If they approve it, then the whole House and then the Senate will also need to vote on it. In less than 2 hours at 2:00 this afternoon, there is going to be a live stream of the Energy and Commerce Committee marking up this bill, meaning making adjustments and edits. That can be found on their YouTube channel if you are interested and want to see what's happening and how kind of the sausage gets made. But I'll go
Hey,
to the next
Charlotte,
slide.
I'm so
Yeah.
sorry to interrupt. We've gotten a few comments in the chat that folks
Oh,
are having
no.
a tough time hearing your audio.
You know what? Sometimes this happens and I feel really close to the computer. Is this better? Better or worse?
Much better. Thank
There we
you.
go.
Oh, wait, I got not a lot better. I'll lean super close. Sorry that y'all have to see my forehead this close to the screen today.
Thanks,
No,
Charlotte.
you're good.
Can you go to the next? Okay, better now. Great. Okay. Awesome. I'll get right up in it. Next slide, please. So this is what's included in the bill that was released late at night on Sunday. The most recent version includes major funding reductions, including $715 billion in cuts to Medicaid over the next 10 years. So you'll notice that's less than the $880 billion that was proposed before, but there's still $715 billion proposed. This means there will be huge coverage losses. There is an independent agency called the Congressional Budget Office. So they look at this completely nonpartisan, not on either side of the aisle, but they predict that this will cut coverage for about 13.7 million Americans. This is, of course, a very concerning coverage loss. The proposed program changes include adding work requirements for, quote, able-bodied adults without dependents. So this is not adding work requirements for people with developmental disabilities. It also includes delaying minimum nursing facility staffing standards for another 10 years. So right now, there is a rule that at minimum, someone in a nursing home needs to be checked on once every 24 hours. This would recommend that that rule no longer applies. So you don't have to be checked on once every 24 hours if you're in a nursing home. Additionally, this proposal would freeze provider taxes. This is a way that states get a lot of funding for Medicaid. Providers can pay taxes that the federal government then matches. It ends up giving more money to people who need Medicaid, more federal dollars. And this proposal would stop that. So there would be less money going into Medicaid. Next slide, please. And I think it's handed back over to Charlie. I apologize for being quiet.
Yes, no, I'm glad we were able to hear you because that was a. Oh, okay, go back one. There we go, perfect. Oh, forward once more. There we go, perfect. Thank you. So no, thank you, Charlotte, for breaking that down for us. But y'all, we do have some good news. And we want to talk about some of the work that 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 folks like y'all on this call has taken. This bill was supposed to be released in January. They have been getting phone calls, emails, text messages. I can't say love letters, but letters saying that we are all concerned about this issue. They're uh, they're expected to make changes that had a lot more concerning ideas that has been taken out and not included in this bill at all so far. But we also want to make sure that folks understand this is not the final version of the bill. There is still many more steps that need to be taken and changes can still be made. However, the House is hoping so once this bill gets through committee, it will go to the whole House. And the House is hoping to get this bill passed out of the House and into the Senate side by May 26th, Memorial Day. So, y'all, the time to act is now. We need advocates to be calling their representatives and educating them on these issues and why we are so concerned about these things. Next slide, please. Are we able to go to the next one? Perfect. Thank you. So what can you do, y'all? We obviously need to be staying informed. When we are monitoring the developments and the Medicaid policy and budget proposals, which you can actually stream live on their YouTube page, to really see how that sausage is made, and advocates are contact your Congresspeople to express the concerns around the Medicaid cuts that are being proposed. Share personal stories illustrating the impacts, the importance of Medicaid and DD services in Georgia. And lastly, engage your community. Y'all, it takes a community to raise a child. Well, it takes a community to save Medicaid. Encourage others to reach out to policymakers and offer to be a resource on information on how Medicaid impacts your district. If you're using a waiver program, you are the expert in your own lives. They want to hear from you and they want to be able to say, oh, someone in my district uses this, and I can call on them to help me understand this a little bit better. So, next slide, please. I believe I passed this over to Dana or Rena. No,
Nope,
it's Dana.
Thanks, Charlie. I love that. We should put it on a t-shirt. It takes a village to save Medicaid, right? It will take all of us indeed. So what I'm here, my name's Dana Lloyd. I work for the Georgia Advocacy Office. I'm an African American woman with short curly hair wearing a black shirt with some dandelions on it. So what I want to help us kind of do today is think about what this really means. Charlie and Charlotte have helped us understand the budget process. We've talked a little bit about what all of our organizations do, but what's really happening to folks in Georgia based on this information. That's kind of what I want to center for us. So the first thing that I want to talk about is this leaked proposed HSH budget, right? So first of all, there's a couple important words there. It's leaked. So it was not final. It wasn't even in draft form. And in any administration, this is a wish list, right? The president's budget, the proposed budget that's going to go to Congress is a grand idea of the things any administration might want to accomplish. But for us, it ends up being a little bit of a crystal ball, right? It's giving us some, it's telescoping or telegraphing a little bit for us what might come, right? And it really reflects a shift in some federal priorities that make us worry. So Charlie and Charlotte are right. This isn't final. There are lots of steps. We have time to advocate, but the urgency, right, is there because the proverbial writing is on the wall, right? We see what the administration's priorities are, and Charlotte and Charlie really talked about this idea that this has to be drafted again, move through the congressional process, and eventually gain majority congressional approval, which is where we have this time to put in our energy and effort to advocate. But we know what we're up against, right? And so that is in some ways the biggest benefit of this is that we know what we're up against. What's concerning in the budget is that it proposes elimination of core funding to all of the organizations you've heard from today. All of our organizations, GAO, the Council, the Statewide Independent Living Center, and both the USEDs do receive funding from other sources other than this funding, but it is the core of our funding. So you heard Darcy earlier talk about and show that statistic of how much this is of the federal budget, right? That 0.0000001%. That's what it is of the federal budget. But the elimination of this funding for our organizations are numbers like 90%. And 80% and 70%, right? So without those funds, the DD network isn't able to do the work for Georgians with developmental disabilities, right? And so that's what we really have to understand is if you think IPSI programs are a great idea, this eliminates the funding that Georgians are able, that the council is able to put towards that. If you were really excited to hear about the work that the DD Network did this year to finally move the needle, finally get the bill passed for the Dignity and Pay Act, you care about competitive integrated employment for people with disabilities, that work is funded by the federal funds that we get to do this work. So these are services that Georgians rely on. The work that we do around accessible transportation and people having access to assistive technology, equitable healthcare, all of these things, all of our programs are funded, and the proposal suggests eliminating that funding. And this really reverses decades of progress in disability rights. It will lead to a reduction in services. The states without federal match do not have the budgets to maintain services at this level. And with reduction in services comes the possibility of increased institutionalization, right? We talk about this often, that unfortunately, home and community-based services through Medicaid are not guaranteed. right? That's not something that states are required to do, but services in nursing facilities have to exist in the state. And so that might be what we see, is that there's more push for those things to happen. And we are sure, we've seen this play out over and over again, that when these sorts of things happen, it really increases the likelihood that people with disabilities will experience abuse and neglect. And we work together as the DD network to move systems change for people with disabilities. We talked about the Dignity and Pay Act, right? And the way that worked is, yes, the council was, Charlotte and Charlie and many members of the council were at the Gold Dome all session, having conversations behind closed doors to make this work. But a part of this is much bigger than that. GAO was surveying people in sheltered workshops, right? Going to sheltered workshops and talking to people and getting their stories and collecting what the barriers were and working with people to try to overcome those barriers. But that information gets fed to the council for them and their advocacy. IHDD is doing this work of supporting the employment work group in order to, again, collect this information and keep the information going. So this is collective work that really happens. We all have specific goals and priorities, but we can use our unique tools to work towards the ultimate goals of Georgians having a good life here in the state, right? And without this federal funding, there's no longer independent oversight that helps us prevent abuse and neglect. There's no oversight, there's no work that preserves this funding and gets it to critical programs. And there's not work to ensure compliance with state and federal law. Darcy mentioned this at the beginning. The DD network was created over 50 years ago as a response and a safeguard against what people with disabilities were being subjected to, right? And that was segregation, isolation, horrid conditions. We could all see those pictures of people in the institutions. And that wasn't that long ago. There are many of us on this call that can touch 50 years ago, that have memories from 50 years ago. And so this organization, right, the DD network, was created so that those things wouldn't happen anymore. We've added laws and policy and new organizations that are designed to prevent that harm and offer opportunities for people to have real lives included in their communities. In many ways, I think of the DD network as the engine that moves forward federal civil rights for people into their local communities. We're the hands and feet and eyes and ears that are doing the work on the ground, helping people know about their rights, educating them about their rights, looking out for correcting violations, and innovating new ways to move things forward. IPSI programs are a perfect example of that. That innovation comes out of the DD network. And dismantling this network and eliminates the funding removes that engine for systemic change. Like all civil rights movements, success isn't defined by one piece of legislation or one informing court case. It's the outcome of people's lives, right? And we haven't yet fulfilled all the promises of Section 504 and the ADA and Olmstead. There's so much more work to do. Our communities are still not fully accessible for people with disabilities. People face discrimination and unequal treatment. People with IDD still have worse health outcomes and shorter life expectancies than their peers. People with disabilities are still underemployed and undereducated. And many people outside of our community are still unaware of these things. So it's like we were building a house. And if the funding stops now, we can't finish the house. But eventually, even the work that we've done will be worn down and decay because we don't even have the resources to maintain what we've already built. So if you're clear that our communities are not meeting the needs of people with disabilities, if you're clear that the house isn't finished, if you're clear that there's still work to be done, then this is the message that we need you to share with your friends and neighbors and legislators, because we all know that the work isn't done. So the DD network is not about a single person or organization on this call. It's about the lives of people with disabilities in Georgia and across this country. So we have to let our legislators and our community know that the work isn't done. So back to our friends at the council.
Thanks, Dana. All right, so we've given you all a lot of information, and I just want to say what Dana was mentioning, our inclusive post-secondary programs. Today, those are actually state funded. So that is one piece of good news. That funding is not at risk. However, it didn't start out that way. Inclusive post-secondary programs started a dozen years ago from the council's federal funds. And that's one of our big goals as a council, is to fund something, essentially to plant a seed and help it grow into a tree and have somebody else take over the tree. So while our IPSI programs today are state funded, all of our other work, including the policy work you've heard about, the support, the technical advice in the bill that ended some minimum wages for people with disabilities. There's a bill signing today that about the death penalty, making it a reasonable standard for folks with intellectual disability to prove they have intellectual disability and they won't get the death penalty. Our work on waivers advocacy and all of our projects, that's all federally funded, as well as a lot of other work that these organizations do. All right, so it all comes down to this: what can you do? So we've talked about Medicaid, we've talked about the DD network. The number one thing that you need to do, and that many of you have been doing, is keep contacting and keep educating your representative in Congress. Charlie mentioned that they want to vote on this version of the budget by Memorial Day. So this is a really great time to reach out to your member of Congress and make sure that they know the value of Medicaid in your life, the value of the DD network. You know, you are the expert, as Charlie said, and so you need to keep educating them. The second suggestion is it's not just about your member of Congress. Especially if you have relationships with other elected officials, this would be a great time to reach out to them and educate them about the impacts of Medicaid and DD network projects and work on your life. The third thing that you can do is, we all have social media accounts, we have emails coming out. You can share those with your networks. There's so much going on these days, right? It's a really busy time for our country. And we don't want these issues that would really impact the disability community to get lost in the shuffle. So again, these are ideas. You may have other ideas, but if this is something that is close to your heart and your life, this is a time that we really encourage you to take action.